Hi, I'm Dr. Wagner. I'm with Northwest Chiropractic and Rehab, and today we're going to go over some of the main causes of things like lower back pain as well as upper hip pain, primarily in the posterior aspect of the hip joint. We're going to talk a little bit about that. First, to understand how the hip itself works is going to be important in going into some of this. So we're going to go a little bit over Anatomy 101. So, interesting thing about the hip joint itself is it functions in a lot of the same ways as the shoulder does. Okay, so we have the acetabulum, that's that big rim right through here, and then we have the femur itself that actually slides in there and it glides around in the femur or the acetabulum itself. Okay, so one of the major functions of the hip itself is squatting. It's one of the most basic functions that we all do. Okay, whether we're talking about power lifter or we're talking about something as simple as you bending over to pick up your child or just pick up something off the ground. So understanding how that works is your hips will go into flexion as well as your legs going to that external rotation. So a lot of times what happens is when we start to lose this normal function through here, it causes a lot of compensations of some of the soft tissue structures. Primarily on the posterior aspect, they start to get shut down. Those muscles and other soft tissue components such as the hip capsule will start creating a lot of discomfort and a lot of pain. So what we're going to do is we're going to go over a few things to help mobilize a lot of those soft tissue areas. Now we're going to start off by using something you can use at home. If you've got an ottoman, you got yourself a little table, even a chair, anything you can use, because what this is going to allow us to do is to maintain that lower back curve and not put so much stress on our back. Okay, so we're going to break this up into the two primary functions, that extreme hip flexion as well as the external rotation. So we're going to start with the hip flexion. So I'm going to start by putting my foot up through here, and what this is going to allow me to do is go down deep into that hip flexion. As you can see at the leg, the hip and the leg are an extreme flexion right through here. So what I'm going to do is I'm just going to kind of rotate around and try to find some of those tight corners that just are not moving very well. Okay, so we're going to hang out in this position. Now, I usually recommend spending about 2 to 3 minutes in this different forms or in different types of positions right through here. Okay, you can even continue with that external rotation by placing your elbow against your knee here and just really driving that home and getting some good range of motion through there. Now the next one we're going to do is we're going to actually work on extreme external rotation of that hip joint. So what we're going to do is we're going to put that leg right through here. If you can kind of get your bottom off the edge of that table there, that way you can really drive that down through here. If this is putting too much torque on your knee, all you really need to do is drop that ankle off there. That's going to help take some of that tension, and you can kind of go through that same range of motion right through there. Again, just really looking for some of those tight corners. You can continue to push that knee off the edge there, so we're regaining some of that external rotation. We also just take that forward, making sure we maintain that good lumbar curve and kind of hang out in here and finding some of those deep areas that are not moving very well. Again, spend about 2 to 3 minutes in that particular area to kind of help work and drive some of that mobility in there. Now, one of my favorite things to do for the hip mobility is by finding yourself right up against the wall, because this is going to do a couple of different things. This is going to help some of the internal groin as well as the internal hip capsule. So the easiest thing to do is want to get our bottom as close to the wall as we can, keeping our feet here. So we're going to go right up against there. Then what we're going to do is we're going to try to keep our feet intact against the wall. And then we're just going to push our knees out of that external rotation. So we're taking this as much tissue slack out of it as we can by bringing those femurs into hip flexion. And we're going to maintain right through here. Okay, if you've got a friend that can also apply a little bit of extra pressure, kind of to continue on through that and work those internal medial aspect of your legs. Okay, again, spending a couple of minutes in that area will also help with that. Now, one of the ultimate ways that we can really work the mobility right through here is by adding some distraction. And I'm going to go over a couple of different ways that you can use a band. Now, with a muscle group or a joint as large as the hip it is itself, I would definitely recommend getting a band that's much thicker than this. Usually one of those blue or green bands would be a really good one. And you're going to bring this out as far as you can. Obviously, you're going to want to use a little bit more stability than just something that's flimsy like that. You can put this up against a door jamb or against some type of pole that's stabilized in the ground. So what we're going to do is, by applying this is going to help shift that whole structure back through there and really mobilize some of that hip capsule. Okay, so we're going to go into that sprinter stretch right through here and really emphasizing that external rotation as we're going through that. Okay, we can take that into different circles. As far as that goes, we can even bring that elbow down to the ground. That's going to further emphasize that hip flexion as well as the external rotation by pushing our shoulder right up against through there. Okay, again, spending about a minute is going to help us get the most out of that one. Okay, now to further emphasize that external rotation, we're going to take this to the side, and what that's going to do is it's going to do a lateral distraction to help bring that finger head back into the acetabulum here. Okay, so we're going to really bring that out through there, and we can also take this out and roll on that foot right through there and really start rolling around into that acetabular area right through there. Okay, so we went over some good stretches that are going to help out with that hip pain by mobilizing some of the soft tissue around through there. Stay tuned, we're going to have some more great hip stretches as well as some things that you can do for that lower back. So we'll see you next time.